Hi, I'm Patricia Greenberg, the Fitness Gourmet. Welcome to Eat Well, Live Well, Age Well, a show that's all about aging well, topics that are important to us to help us keep us well and healthy as we age. My guest today is Rick Henkin, and we're here to talk about the art of caregiving. One of the hardest things we need to face as we age is the reality that we may not be always able to care for ourselves. We're living better lives, much longer lives, and inevitably we'll have to face the time where we will have to rely on others. Why not make that transition as pleasant as possible for all involved, ourselves and our families? Rick is the owner of Senior Helpers Los Angeles. Central West is his district. He provides services that help elder adults stay at home, age in place as long as possible by having assistance other than a family member care for our loved ones' needs. Now, it's one of those issues that we all seem to be thinking about as we move on in years, starting in our 50s. And I hear from a lot of people say, I'm too young to be talking about that. And I always say the sweet spot is around 55, 60 is when we really should start thinking about what we're going to do and hopefully live a long, healthy life and be prepared for our 70s, 80s, and hopefully 90s. So welcome, Rick. I'm real glad you're here. And you can just get started by telling us, first of all, how did you get started in this business?
Well, thank you, Patricia. I appreciate it. It was really a two-step process. I moved my mom from San Diego to LA in 2006 because she couldn't take care of herself any longer. Found a very nice facility for her in the Valley, costing her about $6,000 a month. And she lived there for 7 years, over $500,000 out of her pocket. She didn't have any long-term care insurance. Okay. I think she looked at it when she was in her 80s. And at that point, of course, it's incredibly expensive. According to the US Department of Health and Human Services, 7 out of 10 people over 65 are going to need some sort of long-term care. We're just living longer. Right. Medicare doesn't cover it. Most health insurance plans don't cover it. We're on our own. So I asked my peers if they knew anything about long-term care insurance, and they said no. So I decided to get my insurance license and offer it to my peers. They'd been through it with their parents. They didn't want to be a burden to their kids, but they thought that they were invincible, kind of like you mentioned earlier. And they're not. No one is. Right. The ironic thing is, as I was waiting for my license for senior helpers, my wife was diagnosed with Alzheimer's disease at the age of 65. And you hope it doesn't happen at all, but certainly not for another 20 years. Right. And the fact is, the average monthly cost of 24/7 home care in LA this year is over $20,000 a month. Even 40 hours a week is almost $5,000 a month. Right. So how long before everything you spent your life creating is decimated by the cost of the healthcare? So step 2, it seemed like a natural evolution to me to provide in-home care. My son Eric had suggested it, and he's my partner at Senior Helpers. Okay. Mm-hmm. So that's how I started.
I think everybody needs an extra pair of hands, even when somebody's well, right? Absolutely. Like we had, I will personalize this a little bit too. We had moved my mother-in-law in with us, and she lived to be 101. And those later years were a little harder. We all jumped in. I had multi-generations in my family. You know my story a little bit. I had my mother-in-law, my husband, my grown stepson, and my daughter. At one point, we were all living together. And it was wonderful because I'm big on recruiting family members to help, not exclusively, but for that extra pair of hands that you need, or those gaps in the day. I used to call it the witching hour, when everybody's not quite home from work, but the kids need to come home from school, and there's an elderly person in the house or somebody with needs. And even if you can get somebody in a couple of hours a day, the resistance to having help is extraordinary. Mm-hmm. And so, my next question to you is, what brings people to you? Is it the individual themselves, the family members, social workers? How do people get to you? Because that's the difficult part, is getting the person themselves or the family to admit they need help.
That's true. Yeah. We get our clients from referral sources: hospital discharge, skilled nursing facilities, hospice care, home health agencies, doctors. And of course, we'll have clients themselves call us up, and the family members. Our typical, not the user of our services, but our typical client, if you will, is a woman in her, from 45 to 65, who's a daughter who's looking for care for her parents. Mm-hmm. And she might be, just as you mentioned, be in that sandwich generation where she's not only looking out for her parents, she's still got kids at home. It's a tremendous burden for people, and they don't realize it until they're in it, until they're actually doing it.
And so tell me about the services that you provide.
Well, we provide a variety of services: Alzheimer's care, dementia care, Parkinson's, personal and companion care. The difference between the two is companion care is you need someone to cook and clean for you, tidy up the house, and maybe someone just to sit with, take you on little trips, things like that. And then personal care is when you can't do some of the things for yourself that you used to be able to do, what are called the activities of daily living. And those are things like bathing yourself, grooming yourself, feeding, dressing, going to the bathroom, moving from bed to chair. It's called transferring, and incontinence. And those are some of the things that are necessary. One of the things that Senior Helpers does, Senior Helpers is teamed up with a woman named Tipa Snow, who's a renowned dementia care expert. And she's created Senior Gems, which is a model that provides effective strategies for support and care for normal aging all the way through late state dementia. And our caregivers they're continuously trained. They undergo training with that. And of course, the state requires training every year as well.
Yeah, so I was going to say that. So you have, is it more of a? They have training on how to care for patients, and what level of medical care are they allowed to give?
Under the state license, no medical care.
Okay.
They can prompt people to remind them to take their medication, but our caregivers, they're not nurses. They're not allowed to give any sort of medical care. Doesn't mean we don't have nurses who can do that, but your typical caregiver under their home care aid license isn't allowed to do anything medical.
So the caretaker comes in, they know their responsibilities, and what do you do with families who wear the caregiver very thin? That they come in and setting that boundary, do they want them, then they starting to rely on them to clean the house or to do other things? How do you manage that with families? Because now you're looking at, medical care, care that you provide, housekeeping care. It gets to be a lot with someone who has a lot of needs.
Right. It's actually all about the plan of care. One thing Senior Helpers has, they've just introduced, it's called Life Profile. Life Profile is based on 20 years of research into what causes seniors to go into the hospital or have to leave their home. And it's data driven. It actually will score people in 5 areas: quality of life, burden of care, autonomy, safety, and medical condition management. And by scoring them, you can actually predict whether a person will be in the hospital in the next 3 to 6 months. Here are the steps taken to reduce that risk. And ultimately, a better care plan for the caregivers and the families results in a better outcome for the client. I don't know if you're aware of this, but in this country, statistically, 21% of people that leave the hospital are back in within 30 days for the same situation. And Medicare is now dinging the hospitals if that happens. Insurance companies are dinging the hospitals and doctors. And they've done studies with Life Profile that have reduced that to 3%. I mean, it's huge.
Amazing. That's amazing.
Yeah, saves a tremendous amount of money.
Excuse me, Rick, is that due to people non-compliance once they're released from the hospital, or that's neglect on the part of the hospital? I know that's a kind of black and white question, but
well, it's what's called social determinants of health. The doctor, the hospital releases you. They don't know what's going on at your home. They don't know if you're following what they're asking. Maybe you're mixing your medications. You're not, you have unsafe conditions at home. All of that. That's where we come in. We do that assessment in the first place to reduce all of those types of risks. So you're not going to, hopefully you're not going to go back to the hospital.
Right. It's more and more, the hospital system is so complicated and so confusing. To be home is so much better. And I know in the little bit of studies and research I did in this, it's just so much better to have somebody at home for their sake and for your sake, and you can really keep an eye on them.
Most people would prefer to stay in their own home, eat
Right.
their own food, sleep in their own bed,
Exactly.
visitors in their own familiar surroundings. Absolutely.
Rick,
Absolutely.
do you help families set up their house for handicap access? I know that starts to become a need later on. Is something as simple as a walker is the first step, but maybe grab bars and, you're getting into, wider doorways and all that becomes a whole nother level of reconstruction.
Absolutely.
But
That's part of what's included in our assessment of safety risks at home. Life Profiles identified 144 significant safety risks. I mean, it's a huge amount.
yeah,
And I have people I can call to put in the grab bars, to put in the ramps, to put in the swing-free hinges on the bathroom doors. Because a lot of times bathroom doors are not quite wide enough for a wheelchair.
right.
Then the person's trying to maneuver around,
Right.
and it's, again, related to accidents. But there's a lot of simple things that can be done. A tub bench. So all they do is, they sit on the outside of the tub, slide their legs over, slide their legs over. They've got a handheld shower wand, and what am I trying to think of? It's the stick-free. The no slip tape on the floor.
Yes, yes,
the shower,
sure.
outside the shower.
Mhm.
Bathrooms are where most of the accidents happen in this country.
Right.
I mean, put water on a tile floor. I mean, you're just waiting for something to take place.
And I don't know, these skid-free mats and tape and so forth, you say are great. And it astounds me that older people, when they remodel the house, I guess because they have the money, they put these high gloss floors in. And it's the absolute worst thing that you can do.
Throw rugs every place.
Yes, exactly. Exactly. Yeah.
Absolutely.
Now, when you have this is always, a touchy subject, and I ask everybody to do this because I haven't cracked this nut in my own life and my own work, is how do you approach an individual that's really, really resistant? I mean, do you, the family member's coming to you, but the patient doesn't want you there, and vice versa, or the patient needs help and the family says, don't worry, don't spend the money, I can do it myself.
Well, the first thing we have to realize is, why is that person resistant? They're resistant to accepting help even though it's needed, because in their mind they're thinking it represents a loss of independence. They might be frightened. They can feel angry that they're in the situation that they're in. They might even feel guilty about becoming a burden to their family. So what we do, of course, is we talk with them and with the family. If necessary, bring in a professional like their doctor and suggest a trial run, describe the care in a positive way. The family caregiver can describe their own needs. I mean, you can't put all that burden on one individual or two individuals. And you have to keep the person who needs the care involved in the discussion and just keep explaining the benefits.
Yeah, the loss of freedom or the loss of ability to take care of oneself is probably the most painful thing that we face in life. Yeah. Your kids leave and you grow up and you have this certain freedom in midlife, even if you have burdens, and as old age approaches, it's very frightening. Rick, I really, really appreciate your bringing the point home with your personal story, and also that, we're all going to get there one day. One of my sayings is, you don't get out alive. And, no one gets out alive, right? And it's, yeah. And we laugh about it, but it's the reality, and, taking care of this younger is better. Now, engaging family members, getting everybody needs a break. And do you find that, I think I was alluding to this earlier, so you have someone in the house giving help, and is it generally a 4-hour shift, an 8-hour shift? I suppose you provide around the clock?
Caregiver, you mean? Well, it depends on what's necessary.
Okay.
Our minimum is 4 hours. You have to figure if the caregiver is going to take the time to drive someplace, they need to earn some money. It's
absolutely
right. But it could be, if somebody needs 24/7 care, maybe it's 3 8-hour shifts.
Right.
And there are people who need 24/7 care.
Right.
Or it could be a 6-hour, it could be an 8-hour. I mean, what we do is we try to assess the needs. And from the family standpoint, because it's expensive, and unless you have long-term care, which helps pay for it, it's out of your own pocket. What we try to do is, we'll do the assessment, and here's a list of all the things that need to be taken care of for your loved one. And I'll ask the family, how much of that can you take or your family members take on and reduce what we have to do, which reduces your costs. So it's a collaborative effort.
Right, right.
Does
And,
that answer
I want to spend also some time discussing how the caregiving efforts affects the family member who's primarily responsible for the patient.
Oh,
Um,
yeah.
I know, that's a whole afternoon, but
It
let's
is.
talk about that a little bit, because I think that would help encourage people, both the patient and the family member, to look for help. Um,
Mhm.
you, you talk extensively about that, about the effect
Right,
it has on the caregiver.
right.
So if you could talk
Especially
about that a little.
family caregivers.
Yeah.
It's a real significant medical phenomenon that has profound consequences. It's the reaction to the physical, psychological, financial, emotional stressors associated with the caregiving experience. And what's unfortunate, it's the single most neglected aspect of healthcare. And the results are devastating for the quality of life, health, and success of the family and the care receiver. It's the reason it's the reason we hear things like, my husband's the person with Alzheimer's, but I'm the one in the hospital. If you're a caregiving spouse between the ages of 66 and 96 and are experiencing mental or emotional strain, you have a risk of dying that is significantly higher than that of people your age who are not caregivers.
Yeah.
It's just the combination of the loss, the prolonged stress, the physical demands, and the biological vulnerabilities that come with our own aging that place us at risk for significant health problems. And I do want to say, though, it's not just older caregivers. It can be younger caregivers who put their health and well-being at risk. If they're a baby boomer who's assumed a caregiver role, like we talked before, for your parents, while simultaneously juggling work, raising kids, you face an increased risk for depression, chronic illness, and a decline in quality of life.
Right. Absolutely.
One other factor is what also happens with family caregivers of any age. They are less likely than non-caregivers to practice preventive healthcare and self-care behavior. It's like, I don't have time for it. I don't have time to make my own doctor appointment. I got to take care of my dad, take care of my mom. So they're sleep deprived. They have poor eating habits. They fail to exercise. They fail to rest when they're ill. All of those things take place as well. And then there's the emotional side of it. I mean, on the one hand, caring for your family member demonstrates love, commitment, can be very rewarding. But on the other hand, all those other things, exhaustion, worry, the continuous care demands are enormously stressful. That's why family caregivers have higher levels of depression and increased rates of mortality.
That is so profound and so scary. And I encourage everybody to please heed Rick's warning that if you are caring for someone else, and I think Rick can back me on this, even if it's minor illness that you're caring for someone, not a profoundly devastating illness, can be very hard on you, because your spouse, your parent, your child, whatever it might be, is infirmed, and it causes deep, deep, deep distress. So even a minor amount of displacement from an ill person in the house can have very profound effects. Please take care of yourself in this somehow, even if it's little. If you can go for a walk, if you can make, an appointment for some self-care. I'm not ignoring the fact that there's a pandemic going on, but there are things that you can be doing to care for yourself. And I personally have gone through this with first my mother, then my father, then my mother-in-law, and my husband had some illnesses on and off the last couple of years, and I have been absolutely exhausted, and I try to sleep when I can. Rick, right, don't be embarrassed to take a nap during the day. If that's the time that you can do it, I tell everybody, old people's nap during the day. No, it's okay to lay down at 3 o'clock in the afternoon for a half an hour if you have to, right?
There you go.
And
there's a lot of emotions involved for a family caregiver.
Yeah.
The first is guilt,
Yes.
which is unavoidable. Your skills are limited, your resources are limited, it's not your fault. And then a big one that I've experienced is resentment. Because sometimes you resent that you've been placed in this position that you didn't ask for, your life's been hijacked. And what if the person you're trying to take care of, your loved one, is resenting you?
Yes.
Helping them because you're a reminder of their loss of independence. I mean, especially if they have dementia, you can't reason with them, you can't argue with them. Yours is the only brain that can change. So you got to not take things personally, but look at it differently.
Yeah, and again, maybe seeking some psychotherapy during this time also is very, please don't be afraid to do that or to reach out. And there are a lot of support groups available online, both on Facebook and elsewhere for people who are in the caregiving position, and there's other people they can talk to. And I love what you said about not feeling guilty and that it isn't your fault, because it's none of this is anybody's fault. Nobody did anything wrong or anything bad. It's just unfortunate life circumstances.
It is. And there are ways to, I'm sorry, were you going to ask a question?
No, go ahead. I was going to let you finish her.
There are ways to lighten the load for caregivers. There's actually 16 different modalities that have been identified, but I'll just go through a couple of them.
Okay.
First of all, validate yourself. You know, the burden of care exists. It can get worse, and you have to plan for it. Get educated. Understand what the disease process is and what's coming next. You can, like you mentioned, get extra help and support, whether it's extra family members or professional caregivers. You need to take time away also. Take time away from the caregiving role, a minimum of 4 times a week for 4 hours at a time. Also, if you can put the right adaptive equipment in place, it makes activities for the loved one easier and safer. Modify the home environment to fit better with their functional skills and safety needs. Bring in professionals if that's what you need. Minimize outings. There's community resources too, even something as simple as Meals on Wheels.
Right.
And of course, counseling and respite care. Take a vacation for at least 1 or 2 weeks. You need to do that for yourself. You know, it's interesting. Think about every time we're on an airplane, if we're allowed to go on airplanes anymore. Every time you go on an airplane, the flight attendant tells you, in case the pressure drops, the mask will come down, put it on yourself first before you take care of the people around you. Why? Because the only way you can take care of the other people is to take care of yourself first.
Absolutely.
And it's something for people to keep in mind. It's one of the most forgotten things to do as a caregiver, because when your needs are taken care of, the person you care for will benefit too. And again,
Rick, I really think that you're never too young to look into this.
No.
I think, young people should start to think about, I don't mean, you're 30 and you're going to be worried about when you're 70 or 80, but as a young person starting out, whether it's buying a home or looking into things that will protect you, whether it's bank accounts or long-term savings, I think this should be part of the conversation, is what am I going to do about my long-term care? Absolutely. I bought long-term care insurance in my 40s. I was lucky. I thought about it pretty early on. Somebody approached me and I said, you know what, that's not a bad idea. Why not? And when I went to get, recommend it and get it to other people, and they were already in their 60s and 70s, it's way more expensive if you can even get it. It's getting harder and harder to get. So that's something to explore for all of us. And for those of you who are subscribers to this YouTube, Eat Well, Live Well, Age Well, I also have a show on long-term health care insurance with Robert Smith, if you want to take a look at that. We drove that point home, and, Rick, I just want to say, what is the best way to contact you for information about senior helpers?
Well, my phone number is 213-712-5700. That's my office phone number. I can give you my cell number as well. Wait, this is gonna be on YouTube, isn't it?
Yeah, so it's okay, we can hear it. Let's re-record that. Okay, that's okay. So Rick, so how can people get in touch with you if they need assistance with senior care?
The best way is my office phone number, which is 213-712-5700.
Okay. All right, great. So I want to thank you so much for joining me today and talking about this, and I wish you all the best, both personally and professionally. We're in a pandemic. We're going to get to the other side, and we'll all get through this. So again, everybody, reach out, find your resources. The things that, make you happy and will keep you healthy is just as important as the person you're taking care of. So thank you, Rick, and look forward to seeing you again.
Thank you.